30 years, 3 decades working as orthopedic surgeon, thousands of surgeries, tens of thousands of patients, countless hours studying anatomy, biomechanics, latest research. And you know what? Only now, looking back, I realize I spent 30 years to understand one simple truth about knees, truth that completely changed my treatment approach, truth that sounds ridiculously simple, but which most doctors, including myself for many years, completely miss. When I started my career in early 90s, I was full of enthusiasm and confidence. I got excellent education, studied everything about knee joint structure, every ligament, every meniscus, every articular surface. I knew how to read MRI, diagnose tears, operate. I was convinced I knew everything necessary for treating knees. My approach was simple and logical. Patient comes with knee pain, I do examination, order MRI, find problem, meniscus tear, cartilage damage, ligament sprain, then treat this specific problem, surgery if needed, physical therapy after, all by protocol. And often it worked. People recovered, returned to normal life, but gradually I started noticing something strange. Some patients didn't recover or recovered temporarily, then returned with same problems or new problems in same knee. I did everything right. Surgery was technically perfect. Rehabilitation conducted by all rules, but result was unsatisfactory. At first, I attributed this to individual characteristics, to each organism being unique, but cases kept growing, and it started bothering me. I began analyzing my failures, trying to understand what I was doing wrong. Turning point happened about 10 years ago. A woman came to me, 42 years old, active, athletic, right knee meniscus tear. Classic case. I performed arthroscopy, removed damaged meniscus part. Everything went perfectly. 6 months later, she returned, pain in same knee, but now different side. New MRI showed cartilage degeneration beginning. Another year later, left knee pain, also beginning degeneration. I sat with her scans thinking, what's happening? Why is healthy, active, middle-aged woman falling apart? And then it hit me. I'd been treating symptoms all along. Meniscus tore, removed damaged part. Cartilage wore, treat inflammation. But I never once asked main question, why did this even happen? Why did this specific woman at 42 tear her meniscus? Not from trauma, not from fall, just in ordinary life. There must be a reason. And I started digging deeper, asked her to come again. This time, not just talk about pain, but show me how she moves, how she walks, squats, climbs stairs, runs, and I saw it. Her biomechanics were completely disrupted. When she squatted, knees went inward, forming X shape. When walking, each step accompanied by slight knee rotation. When standing on one leg, whole body wobbled. Her muscles weren't working right, quadriceps weak, glutes barely activated, deep stabilizers shut off. That's why meniscus tore. That's why cartilage wore. Not because she was aging, not because there was structural anomaly, but because every day, with each step, each movement, her knees received wrong load thousands of times daily. For years, meniscus simply couldn't withstand this constant wrong load and tore. And cartilage wore in places where load was excessive. And what did I do? Performing surgery, I eliminated consequence, not cause. Meniscus was no longer torn, but biomechanics remained disrupted. Knee continued receiving same wrong load. That's why cartilage started wearing. That's why problems appeared in other knee, because same disrupted biomechanics affected both legs. This was revelation. I realized I'd been looking wrong place for 30 years. I looked at structure when I should have looked at function. I treated damage when I should have treated movement. I focused on joint when I should have seen whole body as system. Knee isn't independent element. It's part of kinetic chain. What happens in foot affects knee. What happens in hip affects knee. Posture, core muscle strength, even how a person holds head while walking. All this through chain of biomechanical connections affects knees. And here's what I realized over these 30 years that changed everything. Knees are almost never the problem. Knees are victim of disrupted biomechanics, weak or overstrained muscles, wrong movement patterns. They're just in the middle of chain, forced to compensate all imbalances above and below. When foot collapses, inward walking, knee compensates. When glutes don't stabilize pelvis, knee compensates. When quadriceps is weak and doesn't absorb load, knee receives it directly, day after day, year after year, until something breaks. And then person comes to doctor with knee problem. But problem isn't knee, problem is system. And if you fix knee without fixing system, problem will return. Maybe not immediately, maybe in 6 months or a year, but it will return because cause isn't eliminated. This simple truth completely changed my practice. Now, when patient comes with knee pain, I of course examine joint, of course order MRI if needed, but main attention I give not to scans but observing movement. I watch how person walks, stands, squats, check muscle strength throughout entire leg, from foot to lower back. Assess balance, stability, coordination, and most often find true problem cause far from knee itself. Weak hip stabilizers, tight calf muscle, limited ankle mobility, hyperactive iliopsoas pulling pelvis forward, weak glutes not doing their job, wrong squat pattern developed over years. Now, my treatment aimed not so much at knee as at correcting entire system. Yes, if there's serious structural damage requiring surgical intervention, I perform it. But that's only part of treatment. Main part is restoring proper biomechanics, strengthening weak muscles, stretching overstrained ones, restoring normal joint mobility, retraining movements, how to walk correctly, squat correctly, climb stairs correctly, activating muscles that sleep and don't engage when needed. This takes time. This requires patient effort, but it works. Results exceeded my expectations. People who live with pain for years, whom standard treatment didn't help, started recovering. And not just getting rid of pain temporarily, but truly recovering because we eliminated cause, not just mask symptoms. That woman I mentioned with torn meniscus, I contacted her again, explained what I understood, suggested different approach. She agreed. We worked 6 months on her biomechanics, corrected movements, strengthened needed muscles, stretched tight ones. It wasn't easy. She was used to moving a certain way all her life, and relearning was difficult, but result was amazing. Pain gone completely in both knees, without additional surgeries, without injections, without constant painkillers, simply because her knees stopped receiving wrong load that was destroying them. System started working correctly. 5 years have passed. She's still pain-free. She continues doing her exercises, watches her movements, and her knees are healthy. At 57, her knees are in better condition than they were at 42 when she first came to me. That's what I understood in 30 years. Knees are incredibly durable if used correctly. They can serve entire life without pain, without surgeries, without arthritis. But if constantly loaded incorrectly, they break down. And no surgery, no injections, no pills will help long term if you don't fix how you move. It's so simple, it seems obvious, but I spent 30 years understanding this because I was taught to look at structure, not function. See problem in joint, not system. Treat damage, not movement. Now, I teach this to other doctors, young surgeons, physical therapists. Tell them, yes, study anatomy, it's important. Yes, learn to read scans, perform surgeries. These are necessary skills, but never forget to watch how person moves, because movement is life and correct movement is health. If I could go back to start of my career knowing what I know now, I'd save many people from unnecessary surgeries, from years of pain, from quality of life loss, but I can't change past. I can only change future, mine and my patients' Here's what I want you to remember. If your knees hurt, don't rush, thinking problem is in knees themselves. Look broader. How do you move? Are your muscles strong? Does your biomechanics work correctly? Because in 90% of cases, real problem isn't where it hurts. Find and fix real cause, and pain will disappear by itself. 30 years, long path to simple truth. But better late than never. And now that I know this, I can help far more people than ever before because I finally understood what needs treating isn't knees. Need to treat movement.